Cindy woke up coughing and reached over to her nightstand, picked up the package of Pall Malls, and lit up the first cigarette of the day. Cindy had always smoked Pall Mall cigarettes because she didn't want anything to get between her and the fine tobacco taste of her Pall Mall cigarettes. Cindy had always believed that filters were for sissies, and she was no sissy. She had developed a gravelly voice from her years of smoking and did not sound like a sissy. Cindy got out of bed and started for the bathroom. Unfortunately, Cindy slipped on the throw rug that lay between her bed and the bathroom, landing on her left hip. Cindy began having excruciating pain in her left hip and realized that she had fallen and couldn't get up. Cindy also realized that she hadn't signed up for a lifeline and she was on her own. Over the years, Cindy's bladder had fallen as a result of childbirth, and she had not bothered to get fixed or do Kegel exercises. Cindy had a chronic cough from her pack-a-day cigarette habit. When Cindy fell on the floor, her bladder had released its contents on the floor. Cindy had to drag her body to the telephone located in the hallway. As she was doing this, she thought to herself, maybe I should have taken those hormones and calcium like Dr. Bruce told me for my osteoporosis. Cindy had always been a skinny white woman who smoked at least 2 packs of cigarettes a day, and before the price went up, it had been 3 packs a day. Cindy had been advised to take calcium and the hormones for her osteoporosis, but she said that she was always careful and wouldn't tea break anything. Plus, the hormones caused cancer, and the calcium was constipated. After about an hour, she managed to reach the telephone and dial 911. The ambulance came and she was loaded onto a stretcher. The ambulance then took her to St. Mickey's emergency room. In the emergency room, she had x-rays of her left hip, which confirmed the obvious. She had definitely busted a move, or at least her left hip. An orthopedic surgeon was consulted, and then her family physician, Dr. Bruce, was called at 2:00 a.m. Dr. Bruce was a little less than happy to see her, but came to the hospital and admitted her to his service. The next day, Cindy had her left hip replaced. The surgery went smoothly and she didn't have any problems until post-operatively. Seems like Dr. Bruce and the orthopedic surgeon thought the other one was in charge of preventing blood clots. So neither one put Cindy on a blood thinner to prevent a blood clot. Cindy didn't want to bother with getting out of bed or physical therapy. Subsequently, she developed a blood clot in her leg, which went to her lung. She survived the blood clot to the lung, but her years of smoking had damaged her lungs, making her prone to bronchitis, and she went on to develop pneumonia. Dr. Bruce, who was the medical director at St. Mickey's Hospital, was interested in saving the hospital some money, so he used some intravenous penicillin G for an antibiotic. Unfortunately, the bacteria causing Cindy's pneumonia was resistant to the antibiotic. Naturally, Cindy got worse and went into respiratory arrest, resulting in her being intubated and put on a ventilator in the intensive care unit. Dr. Bruce had been so busy being medical director of St. Meek Memorial that he had not bothered to keep up with the medical literature, which emphasized the importance of getting the antibiotic right within the first 24 hours. Cindy expired and became part of that 20% mortality rate associated with hip fractures. Moro: if you are a skinny white female who smokes, take your calcium and hormones, because for you, osteoporosis is a done deal.